coronal cross-section of the craniocervical junction. What we're seeing right here, this is the anterior edge of the foramen magnum. After removing the superior longitudinal and inferior longitudinal bands, we can identify part of the cruciform ligament, which is composed by a transverse ligament. This transverse ligament goes from colliculus atlantis to the quadrilateral colliculus atlantis, passing behind the odontoid process. Superiorly, we see the alar ligaments that have insertions at the posterior lateral aspect of the odontoid process and drawn laterally to the medial surface of the occipital condyles. Anteriorly, we see the apical ligament that attaches superiorly to the bastion, or the anterior edge of the foramen magnum, and it merges with the superior longitudinal band as well as the anterior longitudinal ligament. Let's move to the next one, and this is a mid-sagittal view of the craniocervical region. So from anterior to posterior, we can identify the anterior arch of C1, the odontoid process, the body of C2, and the posterior arch of C1. This is the cervical medullary junction, the cerebellum, clivus, and from the connective perspective, we see the longus colli that, if we remember, the longus colli attaches to the anterior tubercle of the anterior arch of C1, and superiorly we see the longus capitis that attaches to the basilar portion of the occipital bone. In terms of ligaments, we can identify the anterior longitudinal ligament lying anterior to the anterior portion of the body, and at the posterior portion of the body, the vertebral body, we see the posterior longitudinal ligament. If we move superiorly, this longitudinal ligament becomes the tectorial membrane, and anteriorly, the anterior longitudinal ligament becomes the anterior atlanto-occipital membrane. Posteriorly, we have the posterior atlanto-occipital membrane. A couple of the ligaments that we mentioned previously, but now from this mid-sagittal perspective, we see the apical ligament that attaches from the apex of the odontoid process to the bastion, and we also see the alar ligament that attaches to the medial portion of the condyles, and posterior to it and inferior we see the transverse ligament, which forms the cruciform ligament along with the superior and inferior bands. This is a lateral view after removing the muscles of the subaxial region and part of the craniocervical region as well. And what we're seeing right here from anterior to posterior and superior, we see the posterior valley of the digastric that is going to be attached to the digastric groove. And if we follow that digastric groove, anteriorly we're going to find the stylomastoid foramen, and we're seeing the extratemporal portion of the facial nerve in this region. Now, lying medial and posterior to the posterior valley of the digastric, we see the hypoglossal nerve. This hypoglossal nerve is going to have some anastomosis with the cervical plexus that goes from C1 to C4. And a couple of arteries that we're seeing here in providing blood supply to the thyroid is the superior thyroid artery, and providing blood supply to the larynx, it's superior laryngeal artery. We see also the superior laryngeal nerve, which is a branch of the vagus nerve. We see the common carotid artery, the external carotid and the internal carotid arteries. The cervical sympathetic trunk that travels along these arteries, as well as the internajugular vein and retromandibular vein that are going to be posterior and lateral to the arteries. Moving posteriorly, we see the sulcus arteriosus, V3, the transverse foramen. Around here should be the root of C1. This is C2 with a dorsal and ventral rami, and this is C2 and C3. These two nerves are going to form laterally the lesser occipital nerve, and C2, the dorsal branch, is going to form medially the greater occipital nerve. After reflecting superiorly the major neurovascular content, what we see here is part of the cervical plexus that again goes from C1 to C4. This plexus is going to have a series of connections with the hypoglossal nerve and the spinal accessory nerve. We see from C4 the phrenic nerve running inferiorly, and from C5 to T1 we see the trunks of the brachial plexus being formed. We see the subclavian artery and the thyrocervical trunk giving origin to the inferior thyroid artery. We remember the superior thyroid artery comes out of the external carotid artery, and the ascending cervical artery. Moving medially, we can see the vertebral artery, and we see that this vertebral artery is actually entering the transverse foramen above C6, which is an anatomical variation. It usually travels through the transverse foramen at the level of C5, and what we're seeing here is the anterior tubercle of C6, or tubercle of Chassaignac, and medial to that we're seeing the longus capitis. The longus coli have been cut and also reflected. We see the trachea, and we see the esophagus and trachea, and also we see the recurrent nerve bodies and intervertebral disc of C4, C5 to C7, and even T1. An anterior view of the craniocervical junction and also part of the subaxial region. Medially, we see the anterior longitudinal ligament that is going to become more superiorly the anterior atlanto-occipital membrane, and this ligament is going to be attached to the anterior portion of the vertebral bodies. Over this ligament we have the longus coli, that again the superior oblique part of the longus coli is going to be touching superiorly to the anterior tubercle of C1, and laterally we have the longus capitis attaching more superiorly on the vascular portion of the occipital bone. We see the V2 segment of the vertebral artery traveling through the transverse foramen. We see the anterior tubercle and posterior tubercle of the transverse processes, nerve roots, and we see the V3 segment of the vertebral artery. After removing the disc, we can identify better the uncinate process, and this superior region we see the oncovertebral joint, and more posteriorly we see the dural sleeve of C5, and we also see the posterior longitudinal ligament, which is going to be attached to the posterior region of the vertebral body. This is a posterior view of the craniocervical junction. We see the posterior arch of atlas, the bifid process of axis, transfer process, this long transverse process of C1, the V3 segment, And we also see anterior to the V3 segment, this horizontal portion, we see the nerve root of C1, or the suboccipital nerve. Something interesting about this specimen is an extradural origin of the posterior inferior cerebellar artery, which is something that could be a variation that need to be taken into account while doing any craniocervical approach, since this is a very important uh, blood supply for the elements or the structures in the posterior fossa. And what we're seeing here, this is medial, this is lateral. So this is a view of the upper subaxial region. We're seeing the submandibular gland superiorly. This is going to be the ramus of the mandible. And we see the infrahyoid muscles from medial to lateral, the sternohyoid, and the thyrohyoid muscle. We see the superior valley, or the superior portion of the homohyoid muscle. Laterally, we see the common carotid artery, and we also see the bifurcation, usually at the level of C3, C4 of the internal carotid artery and external carotid artery, and one of the early branches of the external carotid artery, which is the superior thyroid artery. We see laterally the internal jugular vein, and we also can identify the posterior valley of the digastric. Medial and posterior to that, we see the hypoglossal nerve, which is going to give up a branch for the thyrohyoid and genohyoid muscles. And deeper, in a deeper field, we can identify the superior laryngeal nerve, which is a branch of the vagus nerve. And we can also outline the carotid triangle, which is formed anteriorly or medially by the superior portion of the homohyoid muscle, laterally by the medial edge or border of the sternocleidomastoid muscle, and superiorly by the inferior edge of the posterior belly of the digastric. Deeper in this portion, we see the prevertebral fascia. So along this area, we're going to find the esophagus and trachea that will need to be displaced medially, and the vascular components will need to be displaced laterally in order to properly expose the bodies of the subaxial region.